Live from San Diego, this is the Fox 5 News at 10.
As pressure builds to get student athletes in California back into the game, with everything from rallies to let them play today to CIF pushing up start dates for some sports, we wanted to revisit the impact COVID-19 could have on the health of young athletes, specifically their hearts. I recently sat down with a Scripps Health cardiologist and medical director of EP Save a Life Foundation that helps screen teens across the county for potential heart issues about the risk of developing inflammation of the heart or myocarditis that's made headlines this past year. He says although it is very rare, there are new questions parents should ask doctors and sports physicals, starting with their medical history that now should include COVID-19.
That history now must include, did the student have COVID? Have they had any viral symptoms in the last, in the last month or two leading up to the season of whichever sport they're going to play? Did anybody else at home have COVID here recently? And I think that's an important question because adults can be quite ill, and yet their students, their children who are getting ready to go into these sports may have had COVID and had no symptoms whatsoever. And if enough time has passed, a COVID test will be negative. COVID antibody testing, which is also not readily available, may also not show antibodies, but perhaps a student had COVID and wasn't aware of it. And so I think in that medical history, which includes family history, those are new questions that we as medical professionals are asking.
And because the percentages are so low of the coronavirus really impacting a young student athlete's heart, should parents just not worry about it at all?
I think parents should not worry about it in the sense that they're going to make a decision to leave their children out of playing sports. I don't think that should happen at all. I think that parents it should be on their mind as they're going to the pre-participation physical. And a lot of times the parents are the ones that fill out the form. So usually there's a form and the parents will fill it out. Keep in mind that after looking at over 35,000 teenagers, most of the time teenagers are not telling their parents anything that they're feeling or symptoms that they're having. So that's teenagers for you. And so a lot of times the parents are filling out that form. So it's really important for them to continue to accurately fill out those history forms. And if there was COVID in the family, it's not anything that's going to keep their athlete from participating in sports, but it's important for the people who are clearing that athlete to play sports know that. And so I think parents, it's important to say, well, a mom or a dad may fill out, mom had COVID, athlete did not. It's like, okay. And then that may prompt some more questions from the examiner that's talking to the student at the time of the pre-participation exam and say, I understand one of your parents was sick with COVID. Did you have any symptoms at all? Well, I was coughing and my nose was running and I was achy for a day or so, but I didn't even tell my parents. That happens. I mean, we see this all the time, even with worse symptoms. And so I think it's just important for parents to know that if somebody there had COVID in their family, that it's important just to let them know. Again, it's not going to keep anybody from participating. And in fact, when students have COVID, we look at the severity of their illness. We look at were they hospitalized? Do we know if they had heart involvement? And it's going to be the very rare occasion that we actually tell students, sorry, you can't participate in sports. We want those kids out there playing sports. We want them being healthy. And the goal of whether it's EKG screening with EP Save a Life or whether it's these pre-participation exams, it's to make sure these kids can play sports and just be safe doing it.
Dr. Rogers also says it's important to remember that all viruses, from influenza to the common cold, can affect the heart. It's not unique to COVID, and nothing takes the place of talking to your child's own physician who knows them better and their medical history than anyone else. Right now, Save a Life Foundation is waiting for the green light to resume their free heart screenings around the county, but they could restart at any time. And if you'd like to learn more about that and other programs, from learning CPR to symptoms of sudden cardiac arrest, go to fox5sandiego.com and simply click This Scene on 10.